She tries really hard. She's one of those horses where if she knows you and she trusts you, she will give you her all. Even when she doesn't feel the best, like she doesn't try to hurt me, she wants to get to the other side of the jumps, and I love that about her. And I know that when she doesn't participate and she does, you know, tell me that like, I really don't want to do this, there's something going on. She tries so hard, and then it's kind of, she comes out the next day or two and she's like, I just can't. She's angry, she kicks the walls. She just doesn't really want any part of anything. But she definitely has days where she's like, please don't do anything with me. I'd much rather just be outside.
We've been conditioned that many behaviours exhibited by ridden horses are normal for horses, but in fact they're not. They're often a reflection of underlying musculoskeletal pain, and if we resolve that musculoskeletal pain, those behaviours will disappear.
Sue Dyson is known as one of the top equine orthopedic specialists in the world. She's also a lifelong and accomplished rider, having trained and shown several of her own top-level show jumpers and event horses. After graduation, while working in the United States, Sue had the opportunity to ride horses for the legendary trainer and Olympian Bruce Davidson. Later, Sue had her own brush with Olympic fame when Kinvara, a horse Sue trained herself, went to the Olympics ridden by Santiago de la Rocha and jumped clean rounds in both 1988 and 1992. Sue has worked for over 40 years as a clinician, as well as having published over 370 peer-reviewed research papers. And Sue Dyson is on a mission.
I do think we have a problem with the horse industry as a whole. It's rather slow to embrace change.
Sue spends most of her time and energy educating the horse world that what many people consider bad horse behavior, such as pinning ears, bucking, rearing, or simply being lazy, could be due to pain.
So we decided to do some research into these behaviours that I was seeing over and over again. And the question that we asked was, can we determine by looking at facial expression and other behaviours if the horse has musculoskeletal pain? After extensive research, we found significant differences between the facial expressions and whole horse ridden behaviours in lame versus sound horses. We found that there are 24 distinct behaviours in ridden horses that occur at least 10 times more frequently in lame horses versus non-lame horses. For example, lame horses are much more likely than sound horses to hold their ears back for 5 seconds or more, or to hold their tail to one side. Also showed that display of 8 or more of these 24 behaviours is highly likely to reflect the presence of musculoskeletal pain.
Every time I put leg on, she usually swishes her tail, will probably pin her ears at me. It kind of depends on the day. Sometimes she'll really fight me, sometimes she'll be a little better. This is actually probably a pretty good day because she's had a light week, but it takes a lot to get her moving. Once we do get her moving, it's a lot of leg to keep her moving.
The unique thing about horse behavior is that it often needs to serve dual purposes: the performance that we want from them and the expression of what they're feeling. And sometimes those two things are in conflict with each other. The majority of the time, they're choosing cooperation over flight, over aggression, and when we're conscious of the degree to which they're buying in to try and make us happy, and we can return that level of commitment, it deepens our level of connection.
The first time Lauren saw Galina, it was love at second sight.
I saw her in the stall first and I was like, that is a beautiful horse. She just had a really kind eye and we kind of looked at each other and she's cool. I saw her under saddle and I actually didn't like her very much. I was just like, oh, she looks kind of hard to ride. I'm not sure, as a green rider at that point, I was like, I'm not sure I can ride this horse. But once I sat on her and I wrapped my leg around her belly, I was like, yep, I think this one's gonna come home with me. I actually went and bought her a halter with a name tag and a rope before I even signed the paperwork. I really kind of hoped when I got her that she would be the mare that I sat on when I jumped my first Grand Prix. I definitely hoped, you know, this was the horse that I could jump those really big classes on in front of a crowd and under the lights.
But then something in Galina changed.
Soundness-wise, I believe it kind of started 4 years ago very slowly. I'd noticed that, you know, she'd stop at fences she wouldn't typically stop at, she'd rear, she just was not happy. Like, from the look on her face, she'd have her ears pinned, she was just not content. So we went through our first cycle of routine injections, hocks, coffins, then we got her stifles done and treated her for ulcers, and that was a huge improvement. We probably had about 1.5 years of like really good soundness, really good riding. She was about as best as she'd ever been. She started to deteriorate her again. We had her neck injected. She had a little bit of arthritis in her neck. Again, huge improvement. Back to kind of her normal self, really sound. And then I'd say about 6 months ago, things started to go really downhill, where we had all her routine injections, but there really was no improvement. And since then, she's just kind of slowly been going out of work, just from jumping the 130s back down to like the meters, and then at the moment not jumping at all, just because we cannot seem to figure out what's wrong with her and how to help it after our kind of routine injections stopped working for her.
Galina's behavior had changed, yet she didn't appear overtly lame in hand or under saddle.
It's often considered that if a horse appears non-lame in hand and on the lunge on both soft and firm surfaces, that it is genuinely a non-lame horse. But unfortunately, that's not the case. We did a study of 148 horses which were considered by their riders to be working comfortably. And 63% of those horses were lame when ridden.
Unfortunately, when a lot of these behaviors become normalized, it means that many riders and trainers and other professionals don't really know what a happy horse looks like.
So I had the opportunity last year to evaluate 1,010 horses performing dressage tests at a relatively low level, and a significant proportion of those horses showed abnormal behaviours during the test and also exhibited gait abnormalities. So this is not an uncommon problem.
Additionally, several studies indicate a relationship between Ridden Horse Pain Ethogram scores and performance. At both top international dressage and 3-day events, as well as low-level eventing, horses with higher pain scores performed less well. At 5-star 3-day events, horses with a score of 7 or more out of 24 were approximately twice as likely to fail to complete cross-country than horses which scored less than 7.
When we see competition horses exhibiting a number of these behaviors and the judges of the competitions are rewarding that performance as being normal and being acceptable, it really normalizes signs of pain as something that we just accept and don't question.
I hear very regularly from riders and trainers that the horse's behaviors aren't a deterrent for them because the horse is still able to do its job. However, oftentimes I'm back looking at these horses down the road, whether it's months later, with a more sinister problem. Because oftentimes the horses are trying to show us that they have something going on before they display an overt lameness.
I really wish that I had been able to kind of solve this earlier. I feel like I've put, you know, a lot of resources into Galina. I've had, you know, acupuncture, chiropractic, body work, I massage her. I feel like I've tried most of everything. I just really hope that there's something else that I can put into her. Otherwise, you know, I'm just happy to see her out the rest of her days and give her as good of a life as I can.
And you would keep her?
Oh, 100%. Yeah, she's not, I always joke, you know, she's not going anywhere. Personally, I'm not sure anyone else would love her the way I do, but I just couldn't see my life without Galina in it.
So generally with a lameness examination, I first of all want to obtain a comprehensive history from the owner, because that can give me lots of clues about what the problems may or may not be. So do you think she's always swished her tail and been fidgety when you're grooming her?
Yes. She swishes her tail when I groom her, and she also swishes her tail under saddle. I know, I'm sorry. I mean, she never tries to bite me, but she bites everything else.
If you watch horses being tacked up, you may see that they lay their ears back, they may open their mouth, they may toss their head, they may turn their head towards the girth, they may swish their tail, they may fidget, and often these have been described as just girthy horses, or it's been attributed to the horse having gastric ulcers. But we have shown through a study of 193 horses that were observed during tacking up and mounting that there was a significant association between the number of abnormal behaviours shown and the presence of lameness or gait abnormalities in canter, or the horse having ill-fitting saddles, specifically tight tree points, or the rider sitting on the caudal 1/3 of the saddle. And therefore, I believe that these behaviours are exhibited in anticipation of the pain that the horse is going to experience when ridden.
There can be anticipatory behavior in the cross ties that the horse is anticipating pain coming up. Also, when they're being ridden, they may be anticipating that they're likely to experience pain when they do certain movements, and they're bracing for that. They may also be responding to pain that they're experiencing in the moment. All of these behaviors have to do with what the horse is experiencing. They're not making it up, they're really having this experience of discomfort.
All the time she has this sort of V-shaped upper eyelid, which is a reflection of some underlying tension. So although her expression can be soft, there still is some underlying tension there most of the time. I'm then going to examine the horse at rest. So I'm going to see the way it's standing, see its muscle development, and feel the limbs and the neck and the back in a systematic way. Her left hind quarter is slightly less well muscled than her right. The top line of her neck is really well developed, whereas comparatively the back region, so the thoracolumbar and pelvic regions, are less well muscled, which to me would suggest that she's not really been pushing properly from behind and having the normal range of motion of her back. She also has quite deep concavities under the cranial part of the saddle, which would tend to make me think that the tree points may have been too tight historically, and that will impede the ability of the muscles to contract and relax as they should do under tack, and therefore they don't develop as they should do. Hind quarter muscles are really flaccid. They've got very little tone in them, whereas she's has hypertension here. And I think horses are really, really good at protecting themselves and minimising their range of motion in order to minimise their discomfort. She has a really toe-first landing, stabs into the ground.
Yeah, very stabby on the ground.
Maybe slightly positive for the first few steps, but her shaking her head doesn't facilitate accurate evaluation. So in hand, this horse shows a restricted gait both in front and behind, and a very low-grade left hind limb lameness that I think lots of people would not actually be able to detect. So she's really short-stepping all round. She has a bilateral hind limb toe drag. She holds the thoracolumbar sacral region rather stiffly. So her tail doesn't oscillate nicely from side to side because the tail is a reflection of how she's failing to move through her back. So we see the same thing, except the horse has got more inward trunk lean. On the lunge, there was a low-grade left forelimb lameness. And again, the horse did not push from behind and had a short stepping forelimb gait. So based on those observations, I suspect that this horse has probably got pain associated with all 4 limbs, F-O-U-R limbs. Many veterinarians will evaluate a potentially lame horse moving in hand, and if they see an obvious lameness, they may think that is sufficient. I don't believe that that is sufficient, because that lameness may not be the cause of the poor performance about which the owner is complaining. So for me, I have to see the horse ridden, again, unless it's too lame to be ridden, because I need to see all aspects of the horse's gait and behaviour before I can reach a conclusion as to how many problem limbs there may be. She's beginning to tilt the head in episodically. And she has an intense stare in her eye. Bilateral hind limb toe drag. So she moves her head from side to side repeatedly, but also up and down. So the horse frequently has its ears back for 5 seconds or more. There's repeated tail swishing. Lauren's having to work quite hard, so she's using verbal encouragement, which is one of the behaviours. So as we saw on the lunge, she's short stepping both in front and behind. And we can also see the way the saddle is coming off the horse's back all the time, which is a reflection of the poor saddle fit. So this canter is on the forehand. There's not really a suspension phase in the canter. Late behind in the change, looking very uncomfortable. Bracing the back, extending the back and bringing the head up. More difficult to turn to the right. So as Lauren stops asking her to work in an outline, the horse immediately looks more comfortable. It doesn't really hugely improve the quality of movement, but the horse just looks behaviourally more comfortable. Our next goal is to try to determine where the sources of pain are coming from. And in order to do that, we have to use what we call nerve blocks. So we're going to be placing local anaesthetic solution over specific nerves and therefore effectively desensitising the limb from the level of the nerve block and below. So if the horse improves, then we know that the source of pain was coming from below the site of the nerve block. And I'm anticipating we're probably going to have to block all 4 limbs.
But first, the team is only anesthetizing Galina's front left foot and the fetlock and below on the back left. And Galina will not be sedated for the procedure.
Because sedation can compromise the way in which the horse moves, it may enhance a toe drag, and it may have some mild analgesic effect as well.
After the nerve blocks took effect, Lauren and Galina were sent out again to trot in a straight line.
So I think the left hind limb lameness is slightly worse than it was before.
And again, Galina was observed on the lunge line.
Okay, the other way. On the lunge, she was still consistently lame left front going to the right. So I guess my suggestion would be we do a bilateral subtarsal behind. The left hind limb lameness, does she push more from behind? And then we probably have to do a low 4 in front.
And the team goes back in for another set of nerve blocks.
So initially we blocked the left front foot. We still have significant lameness apparent on the lunge on the right rein. So now we're going to go above the fetlock and take out the fetlock region. So we're now going to ask the question in the hind limbs, does the horse have pain coming from just below the back of each hock? So we're going to block the deep branch of the lateral plantar nerve. This is not a specific block. It doesn't take out one specific structure. It takes out several structures, but it is the next step.
You're okay. You guys okay?
We're going to do it involving both hind limbs because we've got a horse that's presented, although lamer on the left hind limb, the horse lacks hind limb push. And we want to see if after this block, the horse pushes better from behind.
Good job.
And now back out for more observation.
And once more, facial expression looks happier too. I think she's improved both in front and behind. I think she's still detectably slightly lame left front. And what we need to know is also, is the horse going to push more from behind, especially when ridden? I think probably if we look back at the behaviours before and compared now, they would be improved. It's a happier picture.
I think she definitely is starting to feel better. I feel like I don't have to work quite as hard to get her in front of my leg. I'm definitely still working. It's not all of a sudden she's got her own engine.
She looks happier. She has her ears forward for quite a lot of the time. There's not been the same glazed expression in her eye, and not the same tail swishing either that you had before. So clearly she is feeling more comfortable. It's always difficult to remove all pain, particularly when you have a saddle that doesn't fit ideally, which can have a substantial effect. So these tree points are really, really tight. And the balance of the saddle is such that there's not really continuous contact with the panel underneath the back.
So Sue and Lauren tried several other saddles in the barn to see if they could find a better fit. And although not perfect, they decided to try one of Lauren's old dressage saddles.
A lame horse is often more difficult to ride. It may not respond to the rider's cues in a normal way. If we take away the pain, the horse immediately becomes more rideable, more responsive to cues, and often the rider's position improves as well, and the horse becomes more comfortable for the rider to sit on. Lauren, would you like to come over to tell us what you feel?
This feels like the horse that I bought, for sure. Good girl. I was able to actually hold a contact.
Yes.
Even in the forward canter, I felt like she wasn't fighting me. She was a little bit looser. I just felt like she was like, I can participate in this game and not feel like we're fighting each other. So that actually felt really good. Good girl.
Your facial expression is hugely improved.
Good girl.
So I think it shows what a huge difference the combination of nerve blocks and improving saddle fit can make. One without the other is sometimes not enough, so you have to address the whole horse, which means the tack, the horse and the rider as well. But clearly Lauren feels an enormous difference, and that's the proof of the pudding. And the horse's behaviour is being transformed, and the quality of the movement.
Galina's Ridden Horse Pain Ethogram scores went from 10 out of 24 behaviors down to 1 behavior after nerve blocks and saddle fit.
So now we've determined the sources of pain, we have to progress with diagnostic imaging in order to try and establish what the causes of that pain are. And then, having established the cause, we can then come up with some management strategy. We're assessing whether or not each structure, particularly the suspensory ligament, is of normal size and shape. It is not a normal suspensory ligament. So this is an area which is increased in echogenicity, which probably represents fibrosis, which is a result of chronic injury. And the horse has a remarkable propensity to lay down this fibrotic reaction around suspensory branches, which is not always good. But I think that we can see enough on these images to explain the lameness that we've seen in Galina. I think the hardest part of my job is giving an owner an open and truthful opinion of what is wrong with their horse if I know in my heart of hearts that it's going to be difficult to fix. Because they've often come to me thinking that I'm going to be able to cure everything. So we know from the nerve blocks that we have a component of pain coming from the left front fetlock region and probably some residual pain as well. We can explain that lameness by the fact that we have significant damage, which is probably long-standing in nature, involving the top of the suspensory ligament and both of the suspensory branches. In the hind limbs, we once again have injuries to the suspensory ligaments, which fits very well with the block responses. What happens in hind limbs is that you probably have chronic degenerative change on which work trauma is superimposed, and we have chronic pain associated with that. So if you were to rest a horse with hind limb proximal suspensory desmopathy, say you rested it for 3 months, I wouldn't be at all surprised if it was equally as lame or lacking hind limb push after 3 months as it was to begin with, because they just don't tend to respond very well to rest. The situation in the right hind limb is slightly complicated because I think that there probably are some adhesions between the enlarged suspensory ligament and the adjacent check ligament, because there is tissue between them which kind of just joins them together. So instead of them being able to move independently, they can't move as well independently, which may contribute to pain.
Sue explained to Lauren the pros and cons of different therapies, such as corticosteroid injections, stem cells, and platelet-rich plasma, as well as describing a surgery that can be performed on hind limb suspensories with a 76% success rate for at least 2 years after surgery.
If you have 76% success rate, it does mean you have 24% failure rate. And we believe one of the reasons for failure is the horses which have had adhesions between the suspensory ligament and adjacent structures. So I couldn't say that I could guarantee she'd be in the 76% success rate. She might be in the 24% failure rate. In saying that, if you are trying to restore her to full athletic function, you don't have many other options. If you were to be thinking, well, we'll say, I'm going to downgrade my athletic expectations for her, then one wouldn't need such an aggressive treatment regime. A little bit complicated too, because in the forelimbs we've got the branch injuries, which based on the block responses are probably a significant contributor to the pain.
So looking at kind of her overall, if she doesn't have a surgery on the hind limbs, and you said that we would have to lower our athletic, what we expect for her, what level would we expect for her if surgery wasn't an option on the hind limbs?
Well, you commented to me, I think, earlier that she was very happy hacking around the property. She's clearly not very happy in the arena. And that level of willingness to go and attitude to work, I think, is a hugely telling observation. So I think she'd be fine being used as a hack horse and enjoying the countryside. I think it's going to be difficult to get her to be comfortable that would satisfy you within an arena situation.
Not the news I wanted to hear, obviously. In a perfect world, it would have been nice to go, this is a simple fix. We rehab or we do an injection and everything goes back to normal. But it doesn't always work that way. And, I've had Galina for a long time. I knew something wasn't right. What that was, of course, you know, I'm not a veterinarian, I can't tell.
I think the horse owner has to be strong. They have to say, I'm the person that knows this horse the best. And if I think something's wrong, even though everybody else in the barn says it's okay, and even if the vet says it's okay, if you feel that something's wrong, stick to your guns and push for further investigation.
Now that I know what it is, I know what my options are, and I'm gonna figure out the best treatment plan that I can for her in deciding what that she wants to do and what's best for her long term. Whether or not, you know, that's throwing everything at her and trying to get her back to, you know, somewhat what she was doing, or having the option to kind of ease her back into work with the options that were given to me, that would be great. But it's also possible, you know, it's definitely, I want to be able, if I do decide, you know, retirement is kind of what we're looking at, I'd love to keep her as close to me as possible. At this wonderful barn, you know, we have some pastures, and keeping her around and being able to, you know, get to hand walk her and love on her.
If you could wave a magic wand and she would understand English and words, what would you tell her?
If I could talk to her and she'd understand me, I think the first thing I would tell her is thank you.
If you could make a wish for all horses, what would you grant all horses?
That, you know, if there's something going on and they have, it's that, you know, all their owners could catch the issue before it got worse. You know, all owners had that magic ability to catch the tiniest little thing wrong or the tiniest little behavioral issue and just go, something's up, let's solve it before it blossoms into something that maybe isn't repairable anymore. So that would be my magic wand if I had one.
I think that we all need to learn to listen to horses, because they are trying to communicate with us, albeit in a rather subtle way.
My wish for horses is that their voices be heard, that behind all this tail clamping and ear pinning is their voice saying, I'm trying so hard to do what you're asking me to do. My wish for horses is for them to have the freedom to be themselves, to feel that they can express themselves and be heard, that they can experience relationships with their humans and other horses, and feel like they have choice and control in their environment.
How you grant all horses one wish? The ability to provide a more consistent communication to the rider, the veterinarian, the trainer. Behavior characteristics, I think, is a large part of that, and just continuing to refine and reimagine how to allow horses to tell that story, I think, is extremely important.
I would want them to have all the space that they desire. That would make me very happy to see them all roaming free, stretching their legs, living in a herd.
Listen, trust your heart, trust your gut, and give them what they need. Allow them to be themselves and be comfortable in what people are asking them to do.